So, understanding your blood pressure. Now, what is blood pressure? When a heart pumps blood through the arteries, artery is like a blood vessel in our body. The heart, it pumps blood through these arteries, and the pressure that is exerted on the arterial wall, if you see this is known as blood pressure. The normal blood pressure is between 120 by 80 mm of mercury. This is where we are checking as a normal. We consider it 110 to between 130, we consider as normal blood pressure. That is a systolic thing. So I'm sure most of y'all must be checking your blood pressure, and you must be having three readings. That is a systolic blood pressure and a diastolic blood pressure, which is very much we need to check on this pressure of it. The systolic blood pressure is nothing but it is, if we consider this as a heart, yeah, when it contracts, and that is a time when the blood gets pumped into the entire body through the blood vessel, which is called the artery. When it contracts, the pressure that is exerted, that is the systolic blood pressure. When the heart goes into relaxation, that is the diastolic. So these are the two main factors which we see is the systolic blood pressure and the diastolic blood pressure. So these are the two components which makes us very much worried of if it is quite high. So as we see is the normal blood pressure is 120 to 80. Anything that goes above it, which is where we start on worrying, where it is 140 by 90 is where it is the highest blood pressure. So the next part we see is how do we monitor blood pressure? The blood pressure is whenever we monitor blood pressure, we have to be relaxed, because that is the time, if we exit and take the blood pressure, it is the time it is going to give us a wrong reading. So always be relaxed at least 5 to 10 minutes before we do the testing of this. We check the range. And always take about 2 readings before we take, because the first one is always when we have always worried that we want to take the blood pressure, and the second one is gives us the right pressure reading. Always use a bare hand below your shoulders and be relaxed. You have to be relaxing on a table, and the machine has to be as at the level of your heart when you check your blood pressure. Take about 2 readings in the morning, 2 readings in the evening. If it is in the normal range, you don't have to check. But if it is coming on a higher side, then that is the time where we need to check the blood pressure. There are different causes of blood pressure. The first and the most important is the high salt diet, because we are very prone of having more of salt in our diet. So this is where the pressure goes high, when we have too much of salt or too much of sodium in our body. Next is being on the weight being on a higher side, and lack of exercise, smoking, alcohol intake, consuming a lot of caffeine. And the very most important is stress. We are very much stressed nowadays with our work, with all our different activities and all. And after that comes the age, gender, ethnicity, genetics. These are all the causes of having high blood pressure. Next is what the risk factors that can have because of having high blood pressure. First thing, when you have high blood pressure, because again, it is a pressure on our heart causing heart disease. This can lead to heart attacks. You can have, it gives different organs are being affected because of high blood pressure, like stroke, you can have kidney disease, and this also can cause dementia. How can we control the blood pressure? As you know, what can cause blood pressure, if we do some changes, our lifestyle changes on what causes the blood pressure, if we keep that into control, then yes, we can control our blood pressure. As I said, that salt intake is the most important thing which causes the blood pressure. So if we reduce our salt intake, we can control our blood pressure. Next is exercise. A minimum of 15 minutes of exercise a day can keep your heart. That's why we say every to be a healthy, we have to be exercising, which is very much important. So if we exercise, reducing salt intake, maintaining our healthy weight, and smoking and alcohol, which is the main factor of having blood pressure. If we control in all these things, this is the main lifestyle changes which we can control our blood pressure. And next, of course, if you have high blood pressure, then medication is the next thing, which most of them who are having high blood pressure will be on medications. So what do we do if we have blood pressure? Whenever we are checking it at home, please do not panic. That's the first thing, is that we see the numbers, and the moment we see high numbers, we start panicking. What is going to happen next, or what are we going to do? Relax. If you have a high number, check maybe after half an hour, see if it's fine. But if it's yes, we are more worried if it is going above 140 by 85 or 90. That is when it is worrying for us. But then if you have these three, we can contact us. Like if we have 140, below 140, then we are relaxed. We do not have much of we are not much of worried about it. But if it goes more than 140, then do contact your GP or go to the nearest pharmacy, get it checked back again and see. And if it is going very high, above 170 of the systolic blood pressure, that is the time you have to go to the nearest A&E and get yourself checked. The main features of having high blood pressure is you're going to have a severe headache, you can get a chest pain, or sometimes you have a visual disturbances. So check on these symptoms where you think of having high blood pressure. And always, high blood pressure, the blood pressure and diabetes, they both go hand in hand. Yeah, because what happens in diabetes, because the blood gets a little thicker in diabetes, this causes fat deposition in the blood vessels, wherein again there's more of pressure that is increasing on the arteries, where again it reduces the thing. So these two factors are the most important things in everyday life. So we have to keep these two things in control to maintain a healthy lifestyle, a healthy body. And that's all I would like to talk about blood pressure.